Well, welcome everybody. It's my real pleasure today to talk to a colleague I've worked with for some time now on herbal matters, Ramana Zahn, up in the north of England, northeast, I think, Ramana, and who's joining us today to talk about herbal approaches or other approaches, but natural approaches, let's say, to the respiratory system and the lungs and respiratory system. So welcome, Romano, and thank you for joining us. Can you tell us a little about yourself and your backstory and how you came into this world of herbal work?
Thank you, Simon. Yes, I'm delighted to be here. Thank you for inviting me along. I started as a herbalist many years ago now. I've been a practitioner for over 30 years, and I am based in the northeast of England. I started off as a microbiologist, as testing food and water in labs, and yeah, I like with many herbalists, I had a health issue at the time, and I looked at my options, and I didn't like what I was presented with at the time. So I wanted to know what other options there were available for a personal health issue that I had at the time. And it was, that like opened up so many doors, realizing that there was so much more to healthcare than, the normal pharmaceutical approach that was available to me at the time.
So 30 years ago, what was there available to learn where you were?
Yes, it was very challenging at that time because there wasn't a lot around at that time. So you had to kind of be in the know. And luckily I had quite wonderful teachers, really. So I started with the School of Natural Healing with Richard Schultz, and I was very, very keen to kind of know much more because he integrated a lot of naturopathic approaches as well as the herbal medicine side. So it was quite a broader approach. But I mean, he was quite extreme in his approaches at times. But very, very fascinating.
So you learned you had broader naturopathic principles from the start, more than just the herbs.
That's correct. Yes, yeah, and it was how we applied the herbs for different conditions, and how we needed to hold the patient through that in other ways, either nutritionally or with hydrotherapy, or just to support mentally as well. So it's using a very integrated approach.
Good. And have you been in practice more or less since then?
Yes, I mean, I started off early on with going down the road of other modalities. So I started with nutrition, kinesiology, naturopathy. So I studied in a lot of different modalities, and it was great. It was exactly what I wanted to do. So I ended up with many qualifications and really trying to use it more as a toolbox and to help bring the right tool out when I needed it. So it was more working with what the patient needs.
Yes. And I gather you've got a fairly busy practice now. So
yes, it is very busy.
You have plenty of track record to fall back on.
Yes, I have to say it surprises me because the Northeast isn't known for its healthy diet or its healthy way of life. So it's wonderful that I've been thriving up here in the Northeast. There's not many practitioners like me up here, but it's nice to have a thriving practice.
Well, thank you for sharing that background and experience with us. We're going to talk about lungs and respiratory conditions now, and as you said, you're a microbiologist, so you probably have a few little insights for us on how the Western approach, the approach that you came from, meshes or not with the natural remedies, natural approaches that you use. How do you see the lungs and respiratory system in your work? Do you get enough?
Yeah, absolutely. It's one of the top conditions that I see in my practice, and obviously, wintertime is very predominant, and it's one of the main systems of the body that is fundamental, of course, because that's where we breathe, we take the breath of life, and it's our connection to life, and it's an organ and a system that can often go wrong because of our environment, for many reasons, really. And it's when you've got a healthy pair of lungs, it really feels wonderful, doesn't it? That you really connect with the world and you really feel alive. It's when you have a thriving pair of lungs, it's just wonderful. And same with, when you're doing sport or fitness, it's that real charge that you have that keeps you in a joyful state. I think it's no wonder why Chinese medicine always talks about the lungs and being joyful.
Yes, and almost a sign of vigor, isn't it? I think it's where the idea comes from. You can measure the qi by the strength of the voice.
Mm-hmm. Yes, yeah.
So that's when it's good, but there's lots of reasons, as you say, when it isn't so good. And I assume northeast, you get a fairly sharp wind off the North Sea at times. So winter must be particularly challenging, as you say.
It is. And we have our fair share of lung issues up here with coughs, colds, flus, pneumonia. We have them all up here too. So it's trying to keep a healthy set of lungs all through the year, particularly at winter time, is really important. So I get to see my practice is very much focused on people that are suffering chronic conditions. So over the years, it's become that I've specialized in that. So often multiple conditions, chronic conditions that have been set for a very long time, or people needing extra help and support on difficult situations. So I do get to see people that are quite, that may have come with previous conditions like TB or pneumonia, where there's been damage to the lungs. So they need quite a lot of support, ongoing support, and they don't want to continuously take antibiotics whenever they know that there might be an infection coming, or they're heading towards winter and they feel that they just need that extra strengthening protocols to get them through the winter without any difficulties. And then I get patients that often may pick up something, and because there is a weakness there, so they need that support. And herbs have been really wonderful in that. I have to say they've been remarkable support and a crutch for a lot of people to try and get through the winter months. Well, as we know, colds and flus don't happen just in the winter, but predominantly they do.
It's very much seasonal, isn't it? Do you have a story that you can tell us as an illustration of some of the work you do, and we can maybe use that as a template for further conversations?
Yes, certainly. So maybe I can talk about a patient. She's in her early 70s. She had TB when she was young, and she's had a history of lung problems. And year after year, she's often had some form of cold or flu, and it will go down to her lungs. So she gets a lot of coughs, colds, and she's obviously very concerned about going into pneumonia because she's had pneumonia a couple of times as well. So she has a kind of she does have a weakness there, and she has asked me for regular support to get her through the winter time. And she's a regular user of herbal medicine. And I think what might be good is to give you some examples of when she came last, and particularly last year, she had a persistent cough, and she said she wasn't diagnosed with COVID at the time. It's always difficult to tell because sometimes you can get false positives. So we weren't quite sure what exactly the full diagnosis is. I do use some testing in my practice, blood testing, but I also use other modalities as well. So I have the alternatives as well, such as kinesiology, iridology, psionic medicine. So there's other modalities that I use in my practice for assessment. So she presented an infection at the time. She was coughing and she had green phlegm. So I prescribed her two combination formulas. One was sweet wormwood, Artemisia annua, andrographis, and licorice. So 3 very potent herbs for that are very antibacterial, antiviral, and antiparasitic. So that was quite a strong formula that I wanted to give her for clearing any underlying infections that were there, that might have been there. And the second formula that I prescribed her was a little bit more of the support side. So that included calendula, figwort, valerian, and sweet wormwood. And in that, there were other issues that I was trying to support her with, because she was struggling with joint pain, she was not sleeping, she was also experiencing breathlessness. So it was to work on slightly different symptoms. So the idea was to clear any underlying bugs, and then to support the organs and internal body systems. And I really like the herbs. Artemisia annua, you'd be aware of, is quite predominant in supporting most of the coronavirus family, and it's been studied as well in COVID infections. Actually, on a side note, you might be interested to know that Madagascar actually produces a drink for that particular condition. They actually used it and made a drink out of it during the COVID infection time. So, most of the studies were coming out of China, and Mexico also did a study on sweet wormwood.
It was I haven't used, so I'm all ears. Tell me more. Tell me more. I mean, what's your experience of using it? How do you find it working with you?
Well, obviously, a lot of people have cottoned onto it, because it's certainly been in demand through the dispensary. So, people are aware that it has an effect with the coronavirus family. So it's very good. The studies on it have shown that it really helps immune modulation. So it works on various stages of the immune system, and it has been studied to reduce the cytokine storm that you would get during a COVID infection. So it minimizes that. And the other aspect was that in the research that they found that it actually reduced the duration of the infection. So you got through it much quicker.
Is unlike the attempts to get rid of, for example, malaria infestations, do you need to keep with Artemisia annua for a longer period of time than other remedies to finish the job, or is it just enough to kickstart the process, the defensive processes?
It depends on the individual, as is always the case. I think it all depends on the history of the patient and how they respond to the herb. I always have to look at each individual case on its own merits, but generally speaking, I would give it for a longer duration. It does have immediate effects with some people. Most of the studies that I know that I've looked at, and certainly my own clinical experience, has shown that you can give it in a tea form or tincture form, and it sort of kicks in quite quickly. I've been surprised at how quickly it can start having a response.
It's a nice bitter apart from anything else.
Yes, it is a very strong, as you said, a very strong antimalarial. So it has been seen to work in similar fashion to the COVID infections as well.
Mm-hmm. And you had the andrographis in there as well.
Yes, that's what I was coming on to, the andrographis as well, and that was studied in Thailand. Actually, they confirmed it as a herb that was useful for the anti-inflammatory effects of coronaviruses. So yes, and it's extremely bitter. Actually, this whole formula is extremely bitter. Yeah,
Well,
normally keep the
your
grapes at
patient
hand.
certainly knows they're taking a herbal medicine, don't they?
Yes, they certainly do. It's called the king of bitters for that precise reason. So yeah, and obviously the licorice gives it a little bit of sweetness, but it's still very bitter. Yeah.
I mean, licorice is such a wonderful remedy for the lungs itself.
Yes, yeah, absolutely. Licorice is wonderful in so many ways. It's very supportive for the lungs, but it also helps the other organs as well. It helps the digestive system, and it's so good for the circulation and supporting the hormonal parts of the body as well. So
I've often noticed that the lungs and the digestive system, obviously they're embryologically linked anyway, but the remedies for them overlap so much, don't they?
They do. And it's interesting, if we get on to the other case that I was going to talk about, that it's a completely different approach. And when you deal with the digestive system, sometimes it's surprising to find that it can clear up some other issues in the lungs.
Yes.
Absolutely. Yeah.
Exactly. I found that. Yes. Yeah. So what happened with this patient of yours? How did that progress?
So yeah, this was a really tough infection that she had, and it wasn't like a quick overnight fix with her. Sadly, it took a little longer than I had expected. What did work quickly was that her green phlegm changed. So I knew that we had got on top of the infection, but she was still producing mucus and the cough was still around, although it was less intense. So it had a corrective measure on the acute symptoms very quickly, but it did take a little longer to clear. But when I say a little longer, some of these infections can last for, quite some time with some people, over 3 weeks for certain. And if we go
in some ways, these chronic obstructive conditions, the infection is almost permanent, isn't it? You can go on for years in a subclinical or clinical form, or rather.
Absolutely. So for her, I would say probably over a period of 3 to 4 weeks, when she started to see it lift out of her lungs completely, to it fully clearing. And bear in mind, this is somebody who doesn't want to use any antibiotics for the infection, and with a higher risk of getting pneumonia.
Which is probably wise if it's all viral anyway.
Correct. Yes.
Yeah.
Yes. What would you turn to otherwise? So that's why I love herbs so much, because they do work on multiple levels. They can work on bacteria, viruses, or parasites, and that's the beauty of herbs.
Did she? Is it a she we're talking about? I didn't pick up on that. Yes. Did she have any sort of the spasmodic, asthmatic type symptoms as well? Was she wheezing or tight in the airways? Yeah,
she did.
So that was the lobelia, was it?
Yes. Yeah. The breathlessness really did affect her quite strongly, and she just couldn't grasp the breath, which is it can get you into a fearful state very quickly, not being able to grasp that breath, and not feeling that you can. It's almost taking away your connection with life, isn't it? It's such an important. It's so integral to our being to make sure that we can fill our lungs and we can breathe with ease. And when that goes, it puts you in such a vulnerable place. So she was feeling that. She was, and often when a patient feels like that, you're going to often need to deal with their mental state as well, because it can send somebody into lack of confidence, taking a step out into the world, engaging with the world. It does you do lose your confidence about going out. So she did withdraw in herself a bit as well. And I think sometimes you need to do that when you're healing anyway, just to kind of retreat in and be able to take stock and find that time for healing and convalescing. So she needed to do that. And when she started seeing the symptoms lift, you could see the change in her mental state as well. And it's helpful to talk that through with a patient, because sometimes they don't see that happening themselves.
So often, one could be diverted into providing, support for mental state when the real support is actually in relieving the physical symptoms.
Yeah. Of course, that's where their natural mental state changes, when they know they're feeling well again.
Yes. And you give them the confidence. Yeah.
Mm-hmm.
Yeah. I was going to just put a flag on the lobelia, because we've got an international audience here, and we need to be very grateful that we're allowed to use lobelia, unlike many parts of the world. And commiserations for those listening who can't, because it is such a fabulous remedy.
Lobelia is wonderful. It's got me out of lots of situations where I needed something, to work very quickly, and it certainly can. And I'm so pleased that we still have it. Really am. And I think it's one of the reasons why in my early years, I wanted to hold on to herbal medicine, and I wanted to put that time and effort into joining professional associations and being able to have a voice for us, because it's so important that we keep our herbs and the supply chain going, and not keep losing them.
Yes, and lobelia is exposed because it's in one of those lists of herbs that can only be provided by practitioners. It's not available for sale to the public. So we it's on the edge all the time, isn't it?
It is, and thankfully it's still there.
So this patient is one that is a recurrent patient, presumably because of her long-standing problem post-tubercular and so on. So presumably she's among the sort of patients who come by each year when weather gets bad and they need another support through the bad times.
That's correct. The weather's a very strong trigger for her, and she's generally very good at keeping herself well. She takes care of what she eats. She looks after herself. So she does maintain her health as best as she can. But the autumn winter time is a trigger for her, or can be, and so she does support her lungs. One of the things that we have worked on also is trying to give her a strengthening formula, just to keep her lungs in good order and keep them thriving. So there's things that you can do even outside of an acute infection to support the lungs. So
what are your favourites?
For supporting the lungs, yes, echinacea is one. That's a really good one to have around for just keeping the general immune system strong. But I like some of the elements that I've already prescribed for her, like licorice is wonderful. Sometimes I've used elecampane. That's it's a very good one too. Yarrow, I've sometimes used yarrow as well. And if there has been conditions, scrofula conditions, that figwort is wonderful. Figwort is there to support the immunity as well.
Yes, another one that I find very helpful is the old cinnamon trick. It seems to be so strong and supporting the lungs, especially against the cold.
Yes, cinnamon it's a very good one, but I don't use that a huge amount in my practice, only because I don't know, probably because I'm quite allergic to it, so I don't tend to prescribe it so much. But it is used. I do use it, and it's a wonderful one.
But as you say, elecampane or elecampane, is however you pronounce it, is one of the classics for especially, I think it was the Romans that brought it over to Britain, I think, to protect themselves against the awful weather. They brought it over from southern Europe, and it's been naturalized since. But yeah, it definitely brings warmth, doesn't it, to the lungs and gives it that
Yes.
boost. Yeah.
And also, I love KN. KN is wonderful. And I particularly love it for a couple of reasons. Those that probably don't have minds that think that herbs work, it's one of the ones I would always say, have you tried eating or smelling chili? How quickly does it work on the body? But it's fabulous.
I'm a little gentler than you. I tend to go for ginger as to prove the point. You're obviously tough up there.
Yeah. So yeah, if you need to break into those kind of minds, it's a very good one to talk about. And also, it's so good for decongesting the sinuses. I mean,
yes,
in a nicer way, just to fry it. And as soon as you start frying chili, I use it a lot in my kitchen. Yeah, as soon as the aroma, that's it. You know, it just decongests. It works incredibly fast. And do
you link? Now we're talking about
sinuses and congestion.
About the sinuses.
It's just a nice way to do it.
Do you tie up the whole of the respiratory system, the sinuses, the middle ear, the throat, and so on? Are they all one to you, or do you have different layers of approach to the respiratory system?
That's an interesting question. Yes, I mean, you can see how far the infection is going into the body. If it's acute and it's early on, you know, if it's still holding in the throat area, or whether it's gone down deeper into the lungs. Yes, and sometimes I would also look at any underlying sort of mouth health as well, not just sort of airborne or triggered, you know, externally.
Indeed.
Any kind of dental work can have a massive effect.
Because the throat is the portal, isn't it?
It is, yeah. And if you've had things like adenoids taken out at an early age, or tonsils, your first line of defense has become weakened. I think anyway, because you know now
that's right.
It's very well studied that they were an important part of our defense system.
Very much. Well, thank you for that. I know you had another story to tell us, and we've got time, I think, to get another case in, just so that we can have another angle on this topic.
Yeah, this is a gentleman. He slightly similar. He's a gentleman, and he was experiencing breathlessness. He didn't have necessarily the signs of infection like green phlegm or coughing or anything. He just had this breathlessness that he didn't know where that came from. He's a gentleman, and he's 36-year-old, and his profession is that he's a taxi driver. Some of his other symptoms that were also interesting was that he often had heartburn, stomach cramps, and constipation. So when I assessed his case, I actually decided that I wanted to deal with the gut first before moving on to any lung herbs. So I started him with, two things. A gentle gut cleanser, and then I worked on an antiparasitic formula. And the reason I did that was because in my checks that I do, it came up as parasites showed up in his testing. So I then treated him for parasites with another very bitter formula. It's the bitters that seem to work very well on.
Yes, I found that. Yes,
on parasites. And the formula that I used for that was wormwood, the Artemisia absinthium. I used black walnut, cloves, cassia, and a bit of tansy.
That's another very strong taste, yes.
Yes, very, very bitter. And in fact, his symptoms cleared up very, very quickly. And surprisingly, his breathlessness eased within a few weeks of doing that, a couple of weeks. And yeah, it was very fast. I was so surprised because I was thinking of going on to starting to treat his lungs, but I didn't have to at all because the gut just cleared it all up. And as you said, you know, the gut and the lungs are very, very much linked in that capacity.
Yeah, no, the obvious connection that people made in the past was that if you gave an emetic in a subemetic dose, so that it didn't work on the stomach so much, it would act as a good expectorant, so that there was an obvious link between irritating the stomach and getting the lungs to move. And the opposite with the mucilages, you know, that obviously can't reach the lungs, but they soothe the gut, and that seems to reflexly relieve some irritations in the lungs. So the fact that the lungs and the gut work together has been recognized for centuries, millennia even. So yes, and I've found the same, that you can almost ignore a lung problem if you've got enough to do in the gut. It will sort it out indirectly. Yeah, so that's very dramatic, isn't it?
Yes, absolutely. And I think I wanted to go down that route because one of the things that I was always taught is always deal with making sure the gut is open and eliminating well before going into strong treatments. So I made sure that was happening. And so dealing with the constipation first and foremost was important. Yeah. So the gut cleanser that I used was just a general supplement that I used, actually, psyllium husks, which are very well known and inert, with some pectin and some activated charcoal and a probiotic that was in a one formula mix.
It's interesting that in some parts of the world, in Central Europe, Germany particularly, I think, if someone has a persistent catarrh problem, conventional physicians would always go for the bowel as their first line of approach. The connection is much more overt between the gut and the airways in some parts of the world.
Yes, I mean, there's a lot of mucus produced in the gut. So if the gut isn't eliminating it, it has to come out from somewhere else. So, yeah.
That's right, yeah.
Thank goodness we have other elimination channels that really are needed. So, yeah.
And it's still the main line, isn't it? Still the main way out is through the bowel and through a proper digestive function. Yeah.
Yes, and I think that's what was so interesting, was how because of his profession, sitting down most of the day, driving a taxi, his gut isn't getting huge amount of exercise. So you have to kind of take that into consideration, is how do you try and get in that condition?
See, the conventional doctor would probably say that the thing that was a risk factor for a taxi driver is inhaling particulates, but you've identified a completely different angle by connecting the lungs with the gut, which is what makes our herbal work so interesting. We have another angle on the story.
Yes, and I think when you take a case, it's certainly worth, you know, there's signs and clues in the case taking of where you can start. And because he presented some of those symptoms, I just thought that would be the right place to start with, opening up the channels and seeing where to go from there. And sometimes it doesn't take that long to get, well, it shouldn't take that long to get the system opened and the gut starting to work. I mean, I have had cases where, you know, whatever you do to the gut, it just doesn't want to work. So but in this case it did, and it was very interesting to see how a completely different approach could work on the same symptom.
Have you found any connection? I'm moving already on because I'm so interested in covering the ground, but we haven't talked particularly about long-term asthma or actual asthma attacks, and I'm just wondering if some of what we're saying is also an angle you might pursue in dealing with someone with those overt symptoms, asthmatic symptoms.
Yes, absolutely. I mean, some of the asthma, it's a little bit more detailed, and again, I have to take each individual case on its own merits. But the gut is very important to deal with when you're dealing with asthma, making sure that that's working and functioning well. And also the microbiome is very important. As you know, that the whole body has its own, each body system has its own microbiome. So it's important to correct that, to make sure that some of the basics and fundamentals are corrected in the body, which in itself can heal the tissue. So then you can go back and then do the supportive work that's needed on the lungs. So there might be a few steps to do before going in directly and treating the lungs.
My experience of asthma is that they're often under supported in so many ways. They're so reliant on their puffers and blowers and these sort of overt anti-asthmatic thing that the rest of them is often neglected. And that's where we can come in, isn't it? We can find all the other places where they need support.
Absolutely. And sometimes you need to look further from just the herbs. I mean, just the way we're breathing and the act of breathing is very important. So whether you're mouth breathing or nose breathing.
Breathing work?
Absolutely.
Do you do breathing work?
Yes, absolutely. Actually, which book was it? I think Jane Nestor documented a lot of breath work, and he looked at all the old philosophies and the scientific evidence around the way you breathe, how important that is to all the other conditions in the body. And actually, what's very interesting is just even reading, some of the 4,000 reviews of his book on Amazon, and seeing what people are doing and how they've experienced, just by changing their breathing technique, the difference that it's made to their lung function.
I find it almost inevitable to link, especially with long-term conditions, to link breath work and the herbs, because they support each other so well. And in fact, they can help each other, and the patient can get the experience of both from each other, so to speak. So they get more benefit from the work on breathing, and with the almost sometimes immediate effects of the herbs, gives us a nice, the reinforcement.
Absolutely. I think it's very important to really need the breath work in when you're treating the lungs. It's really important to get people to just think through how they're breathing during the day, and whether they have sleep apnea at night, and whether that needs to be dealt with too, because that will also affect the lungs. That there are so many factors that need to be taken into consideration with how you're breathing throughout the day. And a lot of people. Yeah, go ahead.
Sorry, I know you carry on. I was just going to raise another completely different topic, but you finish off your line and then I'll come back to it.
No, I was just going to say that, breath work is, it can be so profound in itself as a treatment, and linking it to the herbs and making sure they work hand in hand, as you've just pointed out, should be part of that whole process and planning.
Yeah. The other topic I was going to bring up while we were on the lungs, of course, is their proximity to the heart and the cardiovascular functions, and some of the symptoms we know, with particularly, fluid accumulation in the lungs and so on, is actually due to a failing, right heart, or, other cardiovascular problems. Do you find that you also need sometimes to work on that other side of the thoracic equation?
Yes, I think there are complications, because a lot of patients that come, I see, are on multiple medications, can be on other medications, on blood pressure medication, or any other blood thinners. So trying to incorporate the herbs within that picture is also important that that you're getting into drug interaction territory and treading carefully.
No, you're right.
So with people that aren't on drugs, then it's straightforward to use circulatory herbs to support the heart and blood vessels. They're really good to have side by side if there are issues in the circulatory system. If they're on medication, then you just need to tread a bit more carefully.
Indeed. No, a good point to make. Yes, so by the time people have got that bad in terms of their heart function, then they are usually on a lot of medications. And as you say, the blood thinners are now pretty much prevalent. Everyone seems to have AF these days. And blood thinners are the first port of call.
Yeah, absolutely. And because my practice is dealing with chronic cases, I see people on multiple drugs, and that's where you just need to tread carefully. Obviously, medical profession doesn't like herbs, so we have to do the work correctly and make sure that we do our due diligence.
They accuse us of using blood thinners with every other herb. If you read some of the literature, yes, a little bit over the top. So I think we've made a good case that the lungs and the respiratory system are linked to other parts of the body. We've mentioned particularly the digestive system. Are there any other parts of the work that you picked up? I mean, we've mentioned the throat, we've mentioned the sinuses, we've covered most of the main symptoms that you can get in the lungs. Is there any sort of bits that we've missed out?
I think I touched on the dental work, that you can have pockets of infection in the gums that you can get repeated infections from. And sometimes you need to deal with what's going on in the mouth rather than the lungs. Yeah, and the herbal mouthwashes work beautifully.
Absolutely.
I love them.
No.
You can really
they work instantly as well.
Yeah, absolutely. I just I've been amazed at how quickly they work. So I love them. Yeah, and you can use so many different herbs for that as well. Golden seal, myrrh, are common ones that I put into the mouthwash. Thyme, thyme's also a wonderful herb for the lungs and very antibacterial and antiviral.
I know there was one angle that I missed, which is children. Do you get to see any with your chronic conditions work?
Yeah.
And we know that they're prone to these irritable, dry, non-productive coughs that go on and annoy their parents enormously. Do you have sort of favourite sort of children's lung remedies that you turn to?
Again, all the cases I take on are so individual, so I don't have a standard formula that I go to, but I often will start with making sure the gut is right again with children. And
Good.
Interestingly, I will do some liver work and liver support for children.
What's the connection for you with the liver and the lungs?
They get quite a lot of vaccinations, and because they are getting repeated antibiotics, I find that I want to deal with the liver, and that can be very supportive. That just working on the liver, and you can do it very gently with children, and they're so responsive. I love it. I love working with children.
I love working with children. Yes, whether or not their parents are getting in the way, I still love working with children.
It's very rewarding.